Strawman with Costa Mesa Brief, and we are here today in Costa Mesa, California, on the steps of City Hall covering the Save Our Healthcare rally after Congress this week announced their plans to repeal the Affordable Health Care Act. Why don't you tell us why we're here today?
Well, the reason we're here today is obviously protesting the fact that Republicans in Congress are talking about and actually taking the first step towards repealing Obamacare. We're trying to make sure that that doesn't happen, and we feel that the only way it's going to happen is for people like us to come out here and let our elected representatives know that we want Obamacare to stay. And if anything, we want it improved.
Okay, so the current Republicans in office are saying that they'll come up with a replacement. Now, you mentioned you want to improve. So what improvements can you suggest to them?
Well, first of all, I think talking about improvement is just rhetoric. It's just empty talk. They're going to repeal without replacing, or more likely, they'll make some minor cosmetic changes to the law and call it a repeal. Because the Republicans know that Obamacare is actually very popular. If you look at the poll numbers, people say they don't like Obamacare. But then if they're asked about the actual provisions that are in it, such as allowing children to stay on their parents' health plans till age 26, insurance companies not being able to deny for pre-existing conditions, people love those provisions in Obamacare. So the Republicans don't really want to repeal it. They want to say they've repealed it and keep all the popular stuff. Right, so I don't believe any of that rhetoric. As far as improving it, the main improvement, of course, is to move towards a single-payer system. Because we're stuck right now in a no-man's land where we still have this for-profit system that isn't really working for anyone. People's premiums are going up way too much, and too many people aren't getting this health care that they need. So I think that Obamacare was a useful first step towards single-payer, but maybe we can take advantage of this horrible moment in time to move towards the next step, which is a single-payer system.
So tell us why we're here today.
We're here to just raise awareness about health insurance and the strong possibility that 20 million people may soon be without any health coverage.
Can you show us what your sign says?
Yes. Here it is. Repeal without replace equals murder. Essentially, by stripping away insurance from 20 million people who rely upon it, people will die.
Why are you here today?
Well, I expect to be here at every march and every issue that's at risk with this new administration. Healthcare, I believe what we've been saying all day. Healthcare is a human right, and it's tragic to hear about our elderly, about our children, about people my age who are going to lose healthcare and not be able to function without it.
And what about the people who have to pay double the premiums they were paying before, or lose their doctors when they were told that wouldn't happen?
So I actually don't know a lot of the ins and outs. I'm fortunate in that I have health care through my company. So I'm standing up for all of the people who are less fortunate, who lose a lot access to health care or end up having to pay more for health care. A lot of my friends will have to pay a lot more than they have had to in the past.
We're here today to talk about the healthcare system in the United States of America and the fact that the Republicans are trying once again to repeal the ACA. But it's not only about the repealing the ACA, it's also about demanding a better healthcare system. The ACA, as we know, isn't perfect. They're saying they have something to replace it. No one knows what that is right now. So why not use this opportunity, if you don't like the ACA, to make a better system for the people in the United States of America, a system that is more along the lines of helping the people and not benefiting the insurance companies.
What can they do to improve upon it?
Well, one of the things right now, as far as the bill itself, we know that through the ACA, the rates are skyrocketing for many people. Not everyone is covered. I would personally like to see, and I know many of us would like to see, some kind of single payer or universal healthcare system in the United States. We hear all the time that we're the only developed country that doesn't have healthcare as a right. We need to get rid of this for-profit system. That's what would make it much better.
So why are we here today?
For the Affordable Care Act and Medicare, to help let our representatives know that we are very passionate about keeping those in our government. and a way of our life. These small group organizations, the grassroots, I think are really going to make a difference in getting people together and making people aware of what's going on and such like that, and just being happy to be here with the other fellow supporters and such like that. But hopefully we'll bring change. We have a couple more years, and hopefully we'll be able to get some more people like-minded to us in the Senate and the House of Representatives, so we can, really start making the changes we want to make.
I came here to support Tim and to also bring awareness to what is happening with our healthcare system. One of the things that I think people don't realize that will be coming down the road with these changes that Congress is trying to make is that they're reinstating the lifetime cap on healthcare, which will mean a great increase in the number of lives lost and the number of bankruptcies that occur. I don't think most people know that.
So you're the organizer today, correct?
Yes, I'm an unofficial volunteer with Our Revolution. Bernie Sanders called to have a national day of action to raise awareness about the issue, which basically is obviously about trying to cut millions of Americans' health care. Obviously, there's a lot of controversy over the health care that's in place now, but a lot of people believe that it's not necessarily the best idea just to scrap it without a plan in place first. And so right now they're pretty much going about replacing it before coming up with a plan, when it should be the other way around. And that's all this is. If they can come up with a better replacement and if it makes sense, then we're all for it. But that hasn't been even talked about yet. They have no plan. There's no, we have no idea whatever it is that they're trying to implement, if there is anything they're trying to implement. So we'd like to hear what that is before votes are being taken to repeal it and to just revoke folks' insurance.
Now, Paul Ryan did say this week that they would not pull the Affordable Health Care Act without a replacement. So what replacement can they do? How can they improve upon this?
At the end of the day, it's all about going about everything in the correct order, and they're putting the cart before the horse. And let's talk about a replacement before talking about a repeal. All they're talking about is a repeal. That's all they're voting on, and that's all I'm hearing about. I would love to see whatever their plan is. If it's good, then let's do it. When it comes down to, Trump and his campaign trail said that he would not cut Medicare, Medicaid, Social Security. He said he wouldn't cut ACA, and that's what's happening now. So he became president based on some of the things he said on his campaign, and that was a big one. Folks voted for him. Millions of Americans voted for him because he said he would not cut any of these vital programs. And as we speak right now, they're voting on making those things go away. So like I said, let's talk about a replacement if there's going to be one. Or hey, how about we talk about fixing it? Why can't we talk about fixing what's already in place as opposed to just scrapping it? Pretty much things aren't going the way that they're supposed to be going, and there's a reason why there's over 100 rallies happening across the country right now to raise awareness about it. And thanks to Senator Bernie Sanders for calling this day of action to get everybody out to raise awareness about the issue.
We're here today to let our voices be heard, that we don't want 30 million Americans to be without health insurance, that some of the sickest of the sick are going to die even quicker. 7 million of those 30 million are children, vulnerable, that need the services that are provided. So I just want everybody to have health insurance. It's not a luxury. It's not an Escalade. It's a necessity. We all get sick. We're all human beings. Our bodies need doctors. So I don't know what it is the Congress thinks we're supposed to do. If I could control not getting sick, I certainly would, and so would every other American, but we can't. So this is just something that really is needed. I'm sad for those people that are going to die. The estimate is 36,000 people will die. And if we go in accordance with the amount that are insured, half of those will be children under 18. So, yeah, I am concerned about our country taking that path. We're the greatest country on earth, allegedly. Well, then let's prove it, that we can have health benefits for everybody.
Do you think it's fair to fine people who still can't afford the insurance?
To fine people that can't afford it? No, it is totally and completely unfair. There may be certain clauses in the ACA that should be done away with or changed. However, the answer is not stripping away insurance from 20 million people.
What if the Republicans have a good replacement for it?
Well, if they can come up with a replacement for it, more power to them. But so far, they have not put any plan forward. So everybody should be very cautious about just letting this insurance slip out of their hands. This is going to affect your children, the elderly, anybody that has a continuing illness that relies on medication could possibly die. There will be deaths if they take away insurance from 20 million people that cannot afford it. Their solution is that if you can't afford it, if you can't pay for it, then you don't deserve it. We think healthcare is a human right.
What about the people who were told they could keep their same doctor and that their insurance rates wouldn't go up, but they lost their doctor and had to pay almost double or more insurance?
I would say that a vast majority of Americans that joined the Affordable Care Act benefited hugely. And overall, we've had a huge influx of people that are now covered.
Now, the current Republicans in office have said that they'll come out with a replacement for it. Can you support that if they do?
I think if they can articulate a plan that works, they should articulate that plan, vet it in the public. If it's a plan that works for all people, great. Let's improve what we have already. I think if they can't articulate that plan now, it's probably not ready.
Now, Trump has not taken office yet, so can we really blame him for this at this time?
No.
Because you did say it was one of his campaign promises not to repeal it, but he hasn't taken office yet, so can he block this?
I hope he does, and I hope he either looks to fix what's in place now or come up with a viable replacement before repealing.
Is this just anti-Trump,
Is what just anti-Trump?
this rally?
Well, that's a weird question because, of course, we're anti-Trump in the sense that we are opposed to his policies, which include the repeal of Obamacare. So if being anti-Trump means you're against the repeal of Obamacare, then sure, we're anti-Trump. But if you're asking me, are we only here because we hate Trump? No, the reason we dislike Trump is because he wants to repeal Obamacare, among other very, very bad policies.